board-certified pulmonologist with the Home Rehab Network, Chief Medical Officer, and welcome back to another session of Ask the Expert. Fire away any questions that you may have. I think there was a couple of questions from before as far as someone had their upper lobes removed and should they work on deep breathing? And the answer is yes, absolutely. So the right lung has three main lobes, right upper, right middle, right lower, and then there's segments within those. And then the left side has about two, you could say 2.2. There's the left upper lobe, the left lower lobe, and then there's like a little bit of what's called a lingula. In any case, if the upper lobes are removed, then what happens is the rest of the lungs will tend to do some expanding, and you can continue to do deep breathing exercises, continue to work the diaphragm, continue to work the intercostal muscles, and larger, the leg muscles, even the upper arms, everything will help you in your breathing. So the answer to that is yes, continue to work on deep breathing exercises. The other question was one of the lobes was removed due to cancer, and again, deep breathing exercises is something that you want to continue. We have a question here, can you use too much albuterol where it makes you really shaky, and is there anything I can do to help stop the shakiness? Great question, great question. So yes, the answer is yes. You can absolutely use too much albuterol, and it will definitely make you shaky. That's one of the side effects. What should you do? One is, obviously, if you can decrease the amount of albuterol, there's a couple ways that you can do that. One is obviously just stop, decrease the use of it. The other is you could increase the use of Atrovent, or what's called ipratropium bromide. So you can use that more than you use the albuterol. So that's one way. The other is you can use longer acting, what we call beta agonist. And if you want something in the Nev form, formoterol, or another one is called Brovana, can be used. They're longer acting. They're every 12 hours. So that's another way to go. So those are three ways to decrease the use of albuterol. One is decrease the use of it, increase the use of, or switch over to ipratropium, or use longer acting beta agonists. Another one is levalbuterol. I've seen some studies here or there where it may or may not improve the shakiness. So that's kind of, I would say, an alternative to the first, the three. I had an upper respiratory infection weeks ago, did not clear up all the way, had clear phlegm, and now is frothy white. Okay, so the issue is a lot of times the infection does clear up, the inflammation may or may not clear up, and so you'll start having, or you'll continue to have symptoms. You can continue to have secretions. Seems like they're clear, which indicates that unlikely to be infected at this point. Now they're becoming more frothy, which seems it's typically with more air, and that causes that frothiness. And so it's just kind of a process, and it should go away over a period of time. I have had a terrible cough for 3 years. Recently moved, and the coughing has stopped. Could this be hypersensitivity pneumonitis? So Jenny, yes, it can be. So hypersensitivity pneumonitis, or HP, it starts out as a cough and some wheezing, some shortness of breath, and it progresses to almost like an asthma, and then you can have what's called ground glass, kind of opacities in your lungs. And then eventually you can get a fibrosing type. So it does progress. The good news is your cough is gone now that you moved. Hello, Dr. Shah. I'm doing much better. I gave my cardiologist. He is impressed with your program. Thank you very much. I'm happy. Our goal is really to help people. And again, I think if you make that your goal and nothing else, I think good things happen as a result. So our goal is always here at HRN to help people. That's our primary and our first goal. Also onto the albuterol, can it make you breathe worse if you get too much? So the answer is yes, you can have worsening of your breathing if you use too much. And one of the reasons is you actually cause bronchospasms rather than increasing them. One of those ways may be because you decrease potassium the more you use the albuterol. That could be one mechanism. But yes, if you're using too much, again, try the alternatives. And also, it may be, the question is, why are you needing so much albuterol? Is it because you're so short of breath, or your asthma or COPD is just not well controlled? Maybe you need steroids, maybe you need steroid inhaler or nebulizer, maybe you need rehab. So there's a lot of reasons. So that actually should be looked at first. Dalaresp is now available as generic roflumilast. Are your doctor / pharmacist? Ask your doctor. Yeah. So you're right. It is, but it's better, a little bit better for chronic bronchitis. I was in the hospital for 13 days this past summer. It started with the COPD exacerbation. To date, I still have not totally recuperated. No inhaler seems to work. My way of life has been destroyed and I am unable to walk. So I'm not sure if you're in our program, but this is really, COPD exacerbation will not just take your lungs away and your breathing away, but it'll kind of really take your whole body. And what I mean by that is make you weaker, make you more fatigued, tired, loss of motivation. So there's a lot more to COPD exacerbation than just lungs. It's a whole body experience, and so the whole body needs to recuperate. One of those ways is obviously diet, good nutrition, optimization of your inhalers and nebulizers. But pulmonary rehab is definitely, I would say, probably one of the best ways to recuperate. So if you're not in our program, please come into our program, or if you want to do a local program, that's fine as well. May I take Combivent Respimat intermittently only if I need? Yes, Combivent Respimat is kind of a rescue or intermittent inhaler, and that you can take. Since the COPD exacerbation and hospitalization 7 months ago, I lost my voice. The moment I move too fast, I can speak clearly if I am sitting. Can you help me understand why this happens and how it related to my COPD? My doctor is speechless about why this is happening to me. So I'm wondering if there's any kind of vocal cord dysfunction. So one of the things you may want to do is see an ear, nose, throat doctor to have a kind of a camera put in. They'll numb the area. They'll go usually through your nose. They'll numb it up. They'll go through your nose and take a look at your vocal cords. I used to do it in the office all the time. And they can see if there's any vocal cord issue, especially when you start moving, if that's the case. Now, sometimes thrush can cause loss of voice as well, so you want to make sure there's no chronic thrush in the back of the throat as well. But what it seems like you may have vocal cord issue, or there's a tracheal collapse, and that may be another possibility. So for that, the ear, nose, throat doctor will look at the top for your vocal cords. If that's negative, then you want to move on to looking at if there's any tracheal issues. as a result. So COPD exacerbation, again, it kind of, the inflammatory part of it degrades the muscles, and that muscles can be within the lung or outside. So those are the things that you want to look out for. Should patients on albuterol take potassium supplements or rely on diet alone? So you do not need to take potassium supplements if you're on albuterol, unless you have some kind of a potassium wasting syndrome. Then your doctor will let you know that your potassium is always low. But taking albuterol, a couple times a day is not going to deplete your potassium enough that your diet alone cannot replenish. So it's not something that you need to take extra. I had bronchitis, but I'm still coughing and phlegm is coming up, and I have pain in my lower chest. I use my nebulizer 2 times a day. Will this go away? So eventually it will go away. However, it seems like you need a course of steroids. And if it was me, I would suggest, as me as a doctor, I would probably give you at least 7 days, if not a little bit more, of a steroid that will clear up your chest pain, and it also help your cough. I use breathing treatments of Upelri, formoterol, and Pulmocord. Started HRN 2 weeks now. Is there hope of getting off inhalation therapy? The answer is usually no, but you may be able to decrease it. So the amount of inhalers you take, or nebulizers, you're basically on nebulizers, you may be able to decrease, but typically not getting off inhalers or nebulizers. Kind of the mainstay of therapy for COPD, especially stages 3 and 4. What do you think is the best inhaler for COPD? So there's not just one inhaler that I think is the best, but the combination of what they call anticholinergic plus a beta agonist. So let me give you an example. Anoro would be one of them. That would be kind of a typical good inhaler. Some people are on Trilogy, which is Anoro plus a steroid. And so if somebody has more of an asthmatic or a chronic bronchitic type of a COPD, then Trilogy may be better. Anoro is a good one. And other companies have something similar to the Anoro as well. Are pets necessarily a bad thing to have at home? No, not necessarily. However, we do have a patient who had a pet bird. We'd be very cautious with pet birds. Also, cats and some dogs. But you want to make sure that you're not allergic to them, as that they can bring out an asthmatic kind of a response. And so you could get allergy tested for those as well. Replying to Lynn, okay. Since it's super accessory, okay. So Lynn, I think I have answered this. If not, you can re-ask the question as far as your speaking clearly goes. If you want to scroll down. Okay. Going back to pets, and really environment. So there are blood tests, allergy tests that can be done, and then there's skin tests that can be done. So if you're thinking of getting a pet, then you could get those up front. If you have a pet and you think that there's some allergies, you can get tested, through your pulmonologist or through an allergist. Trilogy is super expensive. By ordering nebulizer treatment, Medicare covers nebulizers under Part B and has no cost to me. You're absolutely right. So here's what I always recommend. The drug companies have really done a great job of making the inhalers very expensive for people for no reason. I guess I shouldn't be saying it, but sometimes I will recommend people go to Canada, not go there, but you can get it online through a Canadian pharmacy, some of these inhalers. Now, you're absolutely right. So Medicare Part B as in boy does cover nebulized medication, so sometimes they're cheaper. Part D as in dog is more of the prescription plans. So sometimes when you go to kind of a DME company, they're already aware of the Part B, and they'll go through there. Some of the CVSs that are local or Walgreens, they may try to go through Part D, and it makes it a little bit more expensive. So make sure for nebulizers, they're going through Part B. And now there's nebulizers that are longer acting and the shorter acting, so you can kind of mix and match. I've been to countless specialists and still no explanation for why I wake up from sleep feeling like I'm burning inside all over, but especially in my upper back. Besides difficulty breathing, this burning sensation is in my body is driving me crazy. It's so scary. If I understood what is happening, I could cope with it better. Do you think there is related to my severe COPD? I'm afraid to go to sleep now because I don't want to wake up with this burning sensation, no fever. So that's something I guess we could really, if you set up an appointment with me, we could talk one-on-one. If you're talking about a burning sensation and it's in your back, upper back. Yeah, I'm not really sure. Obviously, in the front, you could think about heartburn or reflux at night. Ischemia or low oxygen levels at night can give you a burning sensation. But upper back, I'm not really sure. Is it a neuropathy? Is it related to your severe COPD? My guess is no, because the only thing that would be consistent with COPD would be any kind of inflammation in the pleural, in the pleura, the lining of the lung, and it just seems like this is only happening at night. So make sure you have adequate oxygen at night. Make sure you're not having any kind of reflux or heartburn. But this is something we could maybe discuss on our own. Maybe make an appointment with me, Lynn. I have a hard time in the mornings after I get off my ventilator. I cough up phlegm and have to get on a breathing treatment ASAP to be able to breathe okay. I'm on oxygen 24/7 and do treatments every 4 hours. Also, I have every 12 hours. This is a normal thing, or do I need something else to do? Kind of normal thing, but the question is, so you're on a ventilator at night. Vicky, is that a BiPAP or what they call a non-invasive positive airway machine, such as a Trilogy machine or an Astro, if that's what you're talking about? In the mornings, you'll have buildup of phlegm because, one, in COPD, you'll be building up mucus and it'll be stagnant. Two, if you're on this ventilator, it may be drying you out more. So you're kind of plugged up. So in the morning, as you're doing your neb treatment, you want to hook up a flutter, and you want to see if there's a HME that can be added to your ventilator, or the bubbling water that can go through the ventilator to kind of give you more moisture. It may be that you're plugging up and having mucus plugs. So that's one possibility. And if that's the case, then try one, like I said, HME or bubbling of the water, and a flutter hooked up to your nebulizer in the morning, and flutter as you're doing the nebulizer. Try to move those secretions around. Make sure you're drinking plenty of water as well. Original cost of nebulizer, no insurance, $4,000 for a month. Wow, that's a lot. I didn't think it was that much. I'm sure you could find a cheaper one on Amazon. So $4,000 sounds like a lot. Make sure that's correct, because that really sounds like a lot to me. What is the best way to build the immune system? The best way to build the immune system, number one, diet. Number two, exercise. So those are really the two best ways to build up any immune system for anyone, whether you have chronic disease or you don't have chronic disease. That is really the best way. Does chiropractic adjustments help COPD? So Sandy, one of the causes, and not COPD per se, but maybe if you're on chronic prednisone, you may have spinal issues, stress fractures in the spine. You may have, as you age, kind of a curved spine, or what they call kyphosis, or what they call kyphoscoliosis. These are curvatures of the spine, and what they do is basically you have a rib cage, and now you're kind of shrinking it down. And so in certain ways, a chiropractor may be able to help a little bit in that sense. Good posture is another thing that you wanna strive for. Because if you're slouching over, your diaphragm is coming up, it's flattening, and your lungs are getting, kind of squeezed, and you're not going to be able to breathe better. So I think there's a few things a chiropractor maybe help you with, but if there's any spinal issue, you may really want to see an orthopedic doctor or a spine specialist. What else? Did I miss any questions? Yeah, I went through that question already. Yeah, I went through that question as well. Okay, so these are really good questions, actually. I want to go back to the build the immune system. So a good diet is really the cornerstone. Obviously, exercise, a combination of aerobic exercise and weight-based exercise. And what I mean by that is some weightlifting, and that doesn't have to be bodybuilding. It can be just very light weights that you're doing as far as the immune system. Now everyone is talking about all these kind of superfoods and things. I'm kind of an old-fashioned guy. I think how it was done, in grandma's time, that's how we really should do it. Try to cut out as much as the sweets. We use a lot of processed foods these days, so try to stay away from processed foods. Home cooked meals are very good. Not too much, but enough to kind of satisfy you, not too many desserts. Can you explain about hyperinflated lungs? Before that, are there any teas that reduce inflammation? So there's a lot of teas that actually reduce inflammation. And I think maybe we should do kind of a separate thing on those. But obviously the turmeric teas, ginger, garlic, these are kind of how should I say, tried and true anti-inflammatory things that you can use. So hyperinflated lungs. So basically hyperinflated lungs, lungs are like a balloon, and sometimes what happens is, especially in COPD, where the lung units are not very, the rubber band effect in the lung becomes very kind of compliant. And with changes in pressure, it can kind of collapse. And when it collapses, the air doesn't get out. And so you basically are putting air in, but you're not allowing it to collapse, to go out because it collapses. So that creates kind of a balloon effect, and it gets bigger and bigger. And in the different parts in the lungs where it happens, that causes kind of like bloated lungs. If you can think of like when you get like a bloated belly, it happens in the lungs as well. And that makes it harder to breathe. So it's kind of like if somebody has a pump and it's hooked up to your chest and it's kind of pumping up your lungs, but not allowing you to exhale. So you have this kind of full feeling. That's what hyperinflated lungs are. Exercise is one of the best ways to get rid of those hyperinflated lungs. Can Tai Chi or yoga help with COPD? And absolutely it can help with COPD, because Tai Chi and yoga is regulation of breathing and decrease in anxiety, which can definitely improve the lung. And there's some strength as well. So timing of breathing, the type of breathing, strengthen up of muscles around, stretching, all of these things that are incorporated in Tai Chi and yoga definitely help COPD. Mullein tea, yes, Karen. Mullein is one of those that has also been shown to help with the lungs. So mullein comes in different forms, and tea is one of those forms, yes. What else? Great questions. Great questions. Check out my new lungs video library on HRN. Yes, absolutely. So here's the other thing I want to say about my new lungs. There's a lot of you out there may not be able to, or their insurance doesn't cover the Home Rehab Network, or you need something additional to the Home Rehab Network. My New Lungs is a great way to kind of do it at your own pace, at your own time, but also as an adjunct to the therapy, the live therapy with with Home Rehab Network. So you'll go through the videos and do them at your own pace. On the days that you're not doing the live therapy with Home Rehab Network. So it's a great kind of conjunction with Home Rehab Network. If your insurance is not covering Home Rehab Network and live therapy, then that by itself is a great way to kind of get the benefits out of our rehab program on your own. But remember, the more you put in, the more you're going to get out of any program, of anything actually, right? So make sure you're putting in more. Is there any natural supplements that are best for anxiety? I cannot be prescribed anti-anxiety meds. I'm on prescribed narcotic pain medications, I am told. I bought Kava, but it does not seem to help. You could try valerian root. That has kind of a calming effect. Lavender also has a calming effect. The other is really ways of dealing with the chronic disease itself would also have decreased anxiety ramifications. So, but you could try valerian root. It comes in a tea, and you could try lavender as well. those definitely have calming effects. When should you get on a lung transplant list? When first diagnosed or when you start declining? So unfortunately, you really don't have a choice in a sense of when you get on that list. However, so you can be evaluated for the transplant. So I tend to like to do it a little bit earlier because at least you're on their radar. And so one of the things is obviously if your lung function is declining, you're getting worse, and you're at kind of stage 4 COPD. That's a kind of a time to kind of see if you're a candidate or not a candidate, that's how I would approach it. I wouldn't wait till you're way really worse off and then try to look. I think it's better to get on beforehand than wait. Is My New Lungs free when you are doing the HRN classes? So it's not free, but it's really cheap. It's as if you go up a little, it's $4.99 a month if you are enrolled in Home Rehab Network. If you are not enrolled in Home Rehab Network, I believe it's $29.99, which again, $30 a month to improve your lungs and your life. I think it's definitely worth it. What procedures or tests should be done before doing a lung biopsy when trying to determine what kind of pulmonary fibrosis I have? Jenny, probably your doctors have already gone through the testing, but usually we want to test if it's fibrosis. You want to know, is it sarcoidosis? Is it autoimmune diseases? And so there's a bunch of blood work that can be done. If it's idiopathic pulmonary fibrosis, it can be related to scleroderma, lupus, and a lot of times IPF does not require biopsy. You can see the pattern on a CAT scan, on a high-resolution CAT scan, and you don't really need a biopsy. Where they would do a biopsy is if they're not sure if this is IPF or some other, maybe it's hypersensitivity pneumonitis with a fibrotic type. Maybe it's something else. They're not really sure. Then they've done the blood work for rheumatologic diseases, for HP, for sarcoid, and they haven't found anything, and they're not really sure. Then that's when they would do a biopsy. Again, I would say best thing to do before a biopsy, if you're in that situation, is rehab or exercise, because that actually helps decrease post-op complications. Diaphragmatic hiatal hernia affects my breathing, and you're absolutely right. It does affect your breathing. The question is surgery or not surgery or what else. Obviously going through a rehab program before any kind of surgery is definitely advised. Very good question. So again, going back to the pulmonary fibrosis, there are several and again, COVID has to be put in there as well. If you had COVID, which is something new, that if you go back to 2019, I would have never even thought about COVID or heard about COVID, right? So now, after these past couple of years, that's one of the things that does cause pulmonary fibrosis. The good news is, as far as I know, it's not a progressive cause of pulmonary fibrosis. So that's really the good news about COVID, although not too much good news about COVID, not too much good news about having pulmonary fibrosis, but there's some types of fibrosis that are not progressive or not so quickly progressive. Now, IPF is very progressive if that's the case. So again, some types you can kind of look at on the CAT scan and kind of make that determination. You don't really need a biopsy, whereas other types, the main reason to really do a biopsy is two reasons. One is we're not sure what's causing it, and the second is if we know what's causing it, will it change our management? Meaning, if we did know what's causing it, it's possible that we would know, that this could be treated. And the other thing is steroids versus Cellcept versus maybe a cyclophosphamide. There's certain medications out there. Also, the duration and the dosages would also change depending on the type of fibrosis. So that's the other reason to get a biopsy, so that we know how best to treat it. Is it a matter of putting you on Ofev or Esbriet, or is it a matter of some of these other medications? Very good question. Very good question. What else? Any other questions? Again, going back to Home Rehab Network, please sign up. Please join us. We'd love to have you. It's 3 times a week. It's 12 weeks. It can be longer depending on if you haven't met your goals, but the baseline is 12 weeks, 3 times a week, Mondays, Wednesdays, and Fridays. And you will note that it's an hour and a half, whereas a lot of programs out there are maybe 30 minutes to 40 minutes. And the types of teaching you will get, or learning and education that you get here at Home Rehab Network, you're not going to get anywhere. You're not going to get it anywhere else. So we want people to be empowered by action, but also by education. So that's really, the goal of HRN, to have action through education, so that you know what's going on with your lungs, you know how to, the techniques that we're going to be teaching you as far as breathing and other techniques, and then relate that to your life. Going up a flight of stairs, the therapists are going to teach you how to do that, what to do when you're out and about. Let's say you're shopping, you're in the grocery store, you start getting panicky, you start getting short of breath, what to do at that point. That's something that you want to learn. It's not like, okay, here you go, here's a treadmill, here's a bike, and we'll see you in about 30 minutes. That's not HRN. That's not therapy, and that's not HRN. So part of the psychological buildup on our end is through education, through the group setting, and through helping you get through the difficulties that life presents itself. So definitely want to make those distinctions with our group here. So Melanie is a great therapist. I'm playing Jingle Bells on the harmonica. My grandson is learning on his harmonica. The dogs howl and dance. So that's really wonderful. That's really great. So part of our, as you know, or if you don't know, part of our kit includes a harmonica. We do harmonica therapy, which helps with not just expanding the lungs, but it actually helps the upper airway muscles, the diaphragm, timing, almost like you would say like a yoga or a Tai Chi, where it's controlling breathing. So it's a very good tool. I'm very, very glad your grandson is learning it as well. So that's excellent. What else? What other questions do you have? Again, going back to Home Rehab Network, please tell your family, tell your friends, tell your doctors. Just let people know we're out here. We're here to help. What causes foamy white phlegm? Okay, so foaminess means there's a little bit more air attached there, so there could be several reasons. The 2 main reasons is, one, is there a component of heart failure in your, do you have heart failure? Because heart failure is very, very common to have this foamy phlegm. And there's other reasons to have foamy phlegm. Some people have foamy phlegm as part of their COPD, as part of their asthma. Um, it just means there's extra air in that mucus. So it's not necessarily a problem in the sense that it doesn't mean that it's infected. It would be treated the same if you have COPD or asthma. If there's a component of heart failure, then that needs to be treated with some diuretics. Now, there's other reasons for having foamy white phlegm, which actually I'm not going to cover because then it gets into a bit more for this class. But if you want to make an appointment, we can go over some of the medications you're on and some of the other issues you may be having, Sandy. So if you want, just make an appointment with me and we can go over other reasons for having that foamy white phlegm. In some forms of asthma, it's normal to have foamy white phlegm. So very good, very good. So the other thing is the holidays are coming up. A lot of people may be putting on a little bit extra weight. People may be eating a little bit more cookies. So make sure you make a good New Year's resolution to join the Home Rehab Network and help get some of those, get some of that weight off and learn some good breathing techniques. So make sure you take everything in moderation and not overdo it as far as sweets or even food. And you make sure after the New Year's you make a good resolution and stick to it as far as exercising. Carbs cause more CO2, and the answer is yes, they do cause more CO2. Now, there is two types of COPDers that you're going to meet, and one type is very skinny, they can't gain weight, and one type is a little bit heavier. So the person who's skinny is going to need a little bit more carbs, and the person obviously a little bit bigger is going to need less carbs. So make sure you know which type you are and how many carbs you need. We do have a nutritionist at HRN, and we'll get her on at some point to talk about the best in optimizing nutrition. Is the air physio a good thing to use? Yes, it is a good thing to use. Any type of flutter is good to use. This is my first time watching something like this, and was very beneficial. Love that I could ask questions and have answers immediately. I think this day and age, everybody wants the answers and questions immediately, and that's what we're trying to do. Give you at least something to work with. Again, if you have very specific questions, give us a call and set up an appointment. We'll be happy to go over things in more detail. Lynn says you're not listed in Aetna Zint Network providers as HRN. Does that mean I cannot join you? So that's not what that means. Lynn, please give us a call, and our staff will help you determine if you are a candidate or not a candidate. So please don't take that as an automatic no. Let our staff go through the process. A lot of times we will get authorization. So as we get the word out more and more, more insurers and more doctors and more patients are getting aware of what we can do. Decrease hospital readmissions, improve lung functions, improve quality of life overall, improve shortness of breath. I mean, there's a lot of different things that as our goals would have it, that we're trying to improve. And that pulmonary rehab in general, but HRN in specific, can really help people to improve with their lung disease. And it's not COPD, all types of lung diseases, and even excuse me, cardiac diseases, cardiac diseases. I think I'm going to need some water. um, but all kinds of different diseases we can help. Um, can you become immune to prednisone? It used to help immensely right away. Now it barely does anything to all to make me feel better. So you really don't become immune to it. However, you can build up almost a tolerance to it in a sense. So um, what I mean by that is if you're on, thank you, thank you. Sorry about that. So if you're on chronic prednisone, let's say you're on 5 milligrams or 10 milligrams a day, it won't have that same effect as it did before. Or you're on it repeatedly, it won't have the same effect as it did the first time or the first few times that you took it. So that there is definitely that part of it. So, but you're not immune to it per se, but you may require a little bit higher doses. Or the situation may not be something that the prednisone is dealing with. Maybe it's something else. So again, talk to your doctor, or if you want, give us a call, and we can help you through that as well. But typically, and there's another question as far as typically people ask, am I going to get used to my oxygen, addicted to my oxygen? That's a very common question. Am I going to get addicted to my oxygen? And as far as I know, no one has ever gotten addicted to their oxygen who needed oxygen. There are some people that psychologically think they need oxygen, but in this situation where you have chronic lung disease, you're not going to get addicted to oxygen. You're gonna, when you need it, you need it. There's a lot of people that should be on it that are reluctant to use it because of stereotypes and what they look like, and a little bit of an ego issue. But really, if you need it, you should take it. Some people are trying to use it more at night and when they're at home, but don't want to use it when they're out. Unfortunately, those are the people that really need it when they're out and not just sitting at home. So make sure you're on the right amount of oxygen and that you're using your oxygen. It's my first time viewing you online, and what you are doing is so beneficial, valuable, and amazing to me. Thank you. Thank you, Lynn, especially because it's very difficult to get out to appointments with difficult breathing and cold weather. Absolutely. Just can't wait to join, and wanted to thank you. Thank you, Lynn. I appreciate it. And the other issue is, I don't know if there was a population explosion, but it's so difficult to get in with any kind of doctor these days. I'm not sure what happened, but it's really very difficult. So give us a call. We can be of any kind of service. We can help you in any way. We will. Joe saying at birth you are addicted. So yes, Joe, you are addicted to that. Actually, that's not an addiction. That's a necessity. Addiction is something that is a little bit different. So I guess a joke well taken. What else, guys? Great questions. I'm really impressed. These are really good questions. And again, as far as insurance issues, please, let our staff do their work, and they will let you know if you are or not. Again, I want to go back to mynewlungs.com. Let's say you're not a candidate for the online, for the HRN live therapy. Please utilize My New Lungs. And if you are a candidate for the HRN live therapy, please use My New Lungs as an adjunct because, again, the more you put in, the more you're going to get out of it. Many years ago, the other one helped me when I had a severe asthma attack. Now I have more like COPD, but my doctor doesn't really want to prescribe the awful, and it's an old medication. How do you feel about theophylline? I think I saying it right, yes. I'm not a big believer in theophylline. I think it was there when we didn't have anything. Um, it's used still, but it's kind of a third line medication, meaning there's several others above it that we would use before we would even go to theophylline. It kind of has some bronchodilatory effects, but it has a lot of side effects, and it has even a toxicity. What I've seen over the last 15 years, people may be on it and their level is so low that it's like, is it really helping? But because they've been on it for like 10 years, well, we don't want to take it off now, kind of thing. So I don't even know if it's working for those people that are even on it. So I would say it's a medication I really don't endorse. So have you addressed Zephyr valves? So Audrey, I have not in this one, but I will say for the right candidate, the Zephyr valve is definitely a good choice and a good idea. It's been shown to help with a lot of things that kind of what we do at HRN also has been shown to help, meaning improve shortness of breath, improve lung functions, even pulmonary pressures, even vascular pressures. So there's a lot of things that the Zephyr valves show improvement with. The combination of therapy plus Zephyr valve is even better, and so I definitely endorse the Zephyr valves in the right patient. And how would you know that? That would be, again, typically an interventional pulmonologist is one that's going to assess you and put those in, and usually your general pulmonologist can refer you to those types of interventional pulmonologist to get tested and to see if you're a candidate for it. So definitely I would say, especially if you have a lot of hyperinflation, definitely you should get assessed for the Zephyr valves. Just joining on pirfenidone and having trouble getting financial assistance, what can I do? There was a fund. I'm not sure if there is now. The alternative is OFEV, which should still have a fund because I don't think it's generic yet. Pirfenidone went generic. It is all over the world. So again, you may consider getting it from outside the U.S. Again, I would talk to my doctor about it, but meaning your doctor about it. But that is an alternative, as pirfenidone was used in the rest of the world several years before it actually came to the U.S. Then it was in the form of Esbriet. That has now been made into generic pirfenidone again. However, it is still pretty expensive. So I would say, make a plea to your insurance. If that doesn't work, you could consider getting it out of the country, such as Canada or United Kingdom. Again, it's all over the world, so it's much cheaper in other parts of the world. Unfortunately, in the U.S., there are issues with laws and government issues that I don't want to get into, but they make things a little bit more difficult. Now, going back to the Zephyr valves, we do work with some institutions that are placing Zephyr valves if you're in the local area, and if you want a referral, meaning if you want to know who is doing them in our area, you can let us know and give us a call. We'll let you know, or I'll let you know, the best places around us. But I would say someone that has good experience putting them in, and good experience as far as number of patients that they've treated. Um, you know, you'd want to go to somebody like that, someone that's not just trained in it, but has done it multiple times on multiple patients. That's how I would approach the Zephyr valves. What else? Very good questions again. Again, if you need any advice, you can set up a consultation with myself. You can discuss with your therapist as well, and obviously discuss with your physician. And what we're saying here is more advice. So make sure you're talking to your doctors before you make any kind of final decision. So this is helpful advice for everyone out there, and always talk to your physician before making any kind of choices. I was told no on the valves because I am allergic to nickel. Yes, so I think we talked about this, Karen. Yeah, so there are some components of the valves that some people cannot use. So it's going to be assessed as far as your PFTs, your CAT scan, and then they'll put it through kind of a proprietary algorithmic machine that tells them, yes, you're a candidate or not. Now, this is a great point, though. Beyond that, the material of the valve is, are you allergic or not? And Karen is mentioning nickel. I'm glad you mentioned that because that doesn't get out too often. There's a lot of people with nickel allergies that cannot use them. Now, I'm not. So there's two main companies that are making valves. One is Pulmonologist, make the Zephyr valve, and then Olympus makes another valve. I'm blanking on the name, but Karen, I'm not sure if you talked to the Olympus people. If their valve is also nickel, I'm not sure. But those are the two main companies that are making the valves. I have 3 Zephyr valves in my left lung. Do they put any in the other lung? I heard just one lung. Europe is putting in both. Yes. So they can put them in both lungs. Spiration. Thank you, Karen. So Olympus makes the spiration valves, whereas Pulmonologist makes the Zephyr valves. And those are the two main valves. Now, Zephyr is the most popular one. Spiration is not as popular, but I'm not sure if they use nickel or not. Maybe Karen, maybe you know. But if you want to comment, if you know, then I can let the audience know as well. They can put them in both lungs. Now, they will let you know if you're a candidate for both lungs or not. But anyway, go through the proper channels, and they'll let you know as far as if it's one lung or two lungs. I have seen them do it in both lungs, so I am aware that they do both lungs in this country as well. Very good. Time has just flown by here, so very encouraged by all your questions. I thank you. Please sign up with Home Rehab Network. Please go online. Please call us. Please ask your physician. Please spread the word to your loved ones, your friends, everyone. Let them know, that we're here. We're here to help, and that we can get you your life back and improve your lung function, improve your breathing.
At least that's what we strive to do.
Thank you very much, everyone. Thank you.